All right, everyone. I think we'll get started with this session because I know we've got a lot to get through. I hope everyone's enjoying their lunch. Please take time to finish your lunch, no rush. You can eat and chat and listen and whatever you need to do as we get our panel discussion started. You're in the room for the Adult Cancer Survivorship panel, so if that's not what you're looking for, I believe the adolescent young adult is straight back, and then the bone marrow transplant is over in the heritage room. So if you're not looking for the adult session, now is your time to go. We won't feel offended. So my name is Lucy Turcott. I am a pediatric oncologist here at the University of Minnesota. I'm the division director of pediatric hematology and oncology, and also the director of Cancer Survivorship Clinical Services and Translational Research at the Masonic Cancer Center. I am so excited to be here moderating this panel today. I think I'm going to learn a lot as a pediatric oncologist, learning a little bit more about adult cancer survivors. We've heard a lot from attendees that they really appreciate the time for questions and the chance to connect with other survivors and caregivers. So we really hope that today's discussion will provide both insight and then opportunities for you to engage with our panel. I am so pleased to introduce our three panelists today. We have Mike Neeson, Allison Brenninger, and Leigh Simmons, and I'm going to let them introduce themselves because I understand that Dr. Blaze has been giving out honorary doctorate degrees to some people over time, and but I will, maybe we can start with Mike at the end.
Sure. Volume okay? It's okay. All right. Yeah, my name is Mike Neeson. I live in Stillwater, Minnesota with my wife, two adult children. Grew up in this area, had all my treatments at the University of Minnesota, and can't say enough good things about the care I've had.
Hi, my name is Leigh Simmons. I'm actually the Executive Office Specialist for the Masonic Cancer Center Community and Outreach and Engagement Division. I have 4 children, 10 grandchildren. I'm a 3-time cancer survivor and glad to be here today.
I'm Allison Breininger, and I am a caregiver for my husband, Sean. He has an underlying diagnosis of Fanconi anemia that causes bone marrow failure and cancer at a rate of around 700 times that of the rest of us. So here at the University of Minnesota, he's had a bone marrow transplant and tongue cancer, throat cancer, esophageal cancer, bladder cancer, skin cancer, gum cancer, all the cancers. So, and then I am an advocate for caregivers and have started a nonprofit called The Negative Space to really shine light on the role that caregivers play in the cancer journey.
Thank you so much to the three of you for being here, and thank you for your willingness to share your stories and being so open with our group today. I'd like to open things up for questions from the group. If you're here in person, you can raise your hand. If you are online, you can type your questions into the chat, and they will be read by our moderators. If anyone has a question right off the bat, I'll take it. Otherwise, I've got plenty to get us started. All right, to our panelists, I'd love to just hear about what have been some of the greatest challenges that you have faced as cancer patients, survivors, and caregivers.
Okay, so, well, here, well, the first time that I had cancer was in 2002. I had abdominal and cervical cancer. And the hardest part for me was getting someone to even acknowledge that there was something wrong. They kept sending me home all the time and telling me, oh, you're just having extravaginal bleeding, it's okay. And then when I started soaking pads, whole pads within 5 minutes, then all of a sudden they were like, oh, rush in. So I came in and they gave me, at 2002, you know, things weren't quite as well scientific as they are now, I'll say that. So the doctor came in and the nurse actually, he said that they could do a biopsy right away. They used to not be able to do them when they contained blood, but now they had worked that out. He went out and he took the biopsy, and then a nurse came in and she just looked at me and she said, do you have a husband? I said, well, we're divorced. And she said, well, do you have anybody that can help you? And I said, yeah, I got family and friends. What's going on? And she just said, well, she made me get off the table and sit in a chair. And then the doctor came in and said, you have cancer. Didn't tell me what kind, just said, you have cancer. So then I went and did labs, and I was lucky enough to be pro bono for Dr. Cheryl Bailey. She took me on, and she walked me through it. She was 8 months pregnant and did 8 hours of my surgery to make sure that I was alive. In fact, I died on the table, but I came back. So, you know, I want to say that the most difficult part was getting somebody to see me as a person and to see that I wasn't just complaining and that there was something really wrong. My second bout with breast cancer actually came because I attended a fireside chat that we hold, and it had been COVID, and I had been COVID crazy, didn't want to go outside, hadn't gone to any kind of appointments or anything. But Dr. Gabri had said that we needed to be more proactive. So I went to the doctor. We didn't feel anything. She did a mammogram, everything was fine, but she said, I still want you to go have that 3D mammogram. And that's when they found out I had breast cancer. So this time around, I had caregivers that were more receptive to me and more caring. And I had a nurse navigator. I had a whole team of people working with me. So the one thing I want to tell people is that even if someone doesn't hear you, your voice can still be heard. Just keep on moving forward until you find somebody that'll listen, because it'll save your life. And you have family and friends and loved ones, and you have a lot to give. So just live life and be proactive.
I'm going to really second that and be an advocate for taking control, you know, of your own destiny a little bit. Because what Lee said, I ran into the same thing, and I work with a number of patients, ostomy patients, cancer patients, and this is common. When I was 45 years old, and I was in perfect health, very active, very athletic, I started to have digestive problems. And so I went to my GP, and I didn't even have a GP. I just called and said, anybody who will see me. And I explained all my symptoms, you know, abdominal symptoms, digestive symptoms, things like that. And he said, I think you're lactose intolerant, right? And so I changed my diet for a few months, and my symptoms didn't get any better. And I went back, and then I was told, repeat your symptoms. You know what, I bet it's gluten. I think you have gluten issues. So I changed my diet again, right? But by now, 7 months have gone by. And to Lee's point, you really have to kind of push. I wish in hindsight I would have a little more. I don't know that the outcome would have changed a lot. But, you know, after 7 months now, I had blood in my stool. And so finally, I got somebody's attention and went in for a colonoscopy and was diagnosed with stage 4 colon cancer and was given an incredibly dire prognosis. But, you know, I guess my message to the group and friends and family you have, if you think something's wrong, you got to keep pushing. Because, you know, the medical industry and a lot of the GPs and things are busy. You know, and if you think something's wrong, like I said, you really need to be your own advocate and keep looking.
I think that for me, it was that this terrible, awful thing was happening to my husband, but then the rest of life kept happening too. So when he was diagnosed, our daughter was 4. And so then we have this kid who's going, you know, who's in kindergarten, and her dad's having a bone marrow transplant. And every place I was, I felt like I was in the wrong place. If I was at home with her, I felt like I should have been at the hospital. If I was at the hospital with him, I felt like I should have been home with her. She would get a sniffle, and I would want to snuggle up with her, but then I would think, I can't get what she's got because he's got no immune system. And so I think that a hard piece was always feeling like I was being pulled in all these different directions, you know, working, parenting, caregiving, and then all of the things that he was no longer able to help with around the house and in life that I had taken on, and just feeling like I was never in the right spot. I was never doing enough. And so the cancer itself was really hard, but it was that life kept going and got harder, and then I had to keep doing all of those things as well.
Got a question back here. Yeah, I can repeat the question so everyone can hear it. So he's asking, what is everyone's opinion on the role of environmental exposures and some of the things that we're exposed to in the environment, our diets, all of those things, and how they might impact cancer risk, and what should we be doing to avoid those exposures?
Well, I can say for one thing, my oncologist, all 4 of them, told me to start doing an organic diet and to cut down on the sugar. And to, I don't, how people have those little, what do you call it, the phone? Earbuds. I can't use those. I have to have the cord so that the microwaves don't go to my brain because I've had so much radiation. I think you have to start looking, well, you do start looking at life differently. And what you consume and what you put in your body. I don't use deodorants with aluminum chloride, aluminum something. Is that it? Well, I know if it says aluminum on the deodorant, I'm not using it. I'll say that. But, my whole life changed. It was like my kids thought I was crazy because, no, we're not eating hot dogs. That's out now. And when we started eating more vegetables and more fruits and things that hadn't been contaminated with all the pesticides, and I don't eat beef, and if I do, it's from somewhere that doesn't treat their cows with a lot of chemicals too. But it does change, and you have to take care of yourself because if the government isn't going to, if you look at other countries, they don't allow a lot of the stuff that we consume, and their cancer rates are a lot lower. So that's my answer to that.
I'll say that, so the underlying disease that my husband has is actually a DNA repair syndrome, a DNA breakage syndrome. And so with him, it's even more, we can go outside right now in the sun, or maybe I'll have a glass of wine later, and my DNA breaks down, but my DNA comes back, and his does not. And so it's even more so to the question that you had. And so but we also have to find the balance, right? He's not supposed to be in the sun, and yet how much joy does the sun bring us, right? And so he doesn't drink and he doesn't smoke and things like that. But, do we eat a hot dog sometimes? We sure do, And so I think that we are aware of those things, and he has SPF clothing and things like that. And he has to make the decision about, so much has been taken from him, that what are some of the things that he says, you know what, I'm still going to go sit in the sunshine. And does that going to cause another skin cancer? Maybe. But today, this is what I need. And so I think sometimes we have to make those decisions too.
Yeah, that's good.
Yeah, I guess, I don't have real strong feelings. I haven't changed things in my life other than I appreciate things a lot more in the last 16 years. But, I would concur. I think moderation, right? You still need to go on and live life and enjoy life and not overindulge in anything. But, just try to make good choices when you can.
Yeah, so Dr. Harpham was asking about some of the challenges of caregiving, and if you have found some kind of mantras or strategies to manage the balances that you were describing.
Yeah, absolutely. So, and if you see at our table over there, all the things say, I'm part of the story. So that's one of them, because caregivers, we often say, I'm not the sick one, I don't get to complain, it's not happening to my body, and we just sort of shove down the impact that it's having on us, but it's having an impact on every part of our physical, emotional, spiritual, financial well-being. And so I'm part of the story is one of them, and just letting myself acknowledge that, hey, sitting through that surgery in that surgery waiting room impacted me today as well. Another one I appreciate or like to say is that delegation is a form of self-care. Mm-hmm. So it's really hard to ask for help, but every task I delegate gives me a little bit of time and energy back in my day, and so that's one that I like to use as well.
Oh, we've got one from online.
Can you hear me?
That's a great question. So, as a survivor, how can we support? Yep, I'll repeat it. So, as a caregiver, or as a survivor, how can we support our caregiver when we feel like we are a burden on them?
Okay, so for the first time I had cancer, I had so many caregivers that I felt like everybody got a break. But this last time, I only had one person. And I knew it was too much for him when he started crying, because I started crying. And I was like, well, I think you should need, he rides a motorcycle, and I said, I think you need some wind therapy. So you go take some wind therapy, and I'm going to take a nap. And then there were other times when I told him, you know, you don't have to take all this on by yourself. Let me call our daughter and see if she can come over. Let me call one of the kids. But he was so afraid I was going to die this time that he didn't want to leave. Even when I got him to go to work, he was a semi-truck driver, he would call me 20 times a day, and I'm like, you know, I'm trying to work too, and I love you, but you need a break. So then I started suggesting to some of his friends, can you guys take him somewhere? Can you call him up and just like, you guys all ride bikes, go ride your bikes. Go to the gun range. Go for a walk. Go fishing, do something, but get him out of here because he's gonna drive me and himself crazy. So, you know, at first, when I was going through the treatments and my skin was coming off and I hurt so bad and there was all the burning and there was no relief, I did hang on to him a whole lot more than what I probably should have. But that day when I was crying because the pain was so bad and I had taken my pain medication and I didn't want to overdo it. And I just started crying and praying to God, help me, just help me. And when he started crying like that, I felt like, oh God, I didn't even notice that you were going through it too. So I think it's real important that we give our caregivers a break and we love on them as much as they're loving on us.
Yeah, I couldn't agree more. You know, my wife, that first few months, you know, she was home all the time, and she's really active. She's got a big social group of friends and different things. I think you really have to, in a courteous, polite way, encourage caregivers to continue on to some degree. Their life has changed, but that doesn't mean they stop their activities and their social functions and things like that. I don't think it's healthy for them to just shut all that down. So if you're either in that position and you feel guilty about leaving, I would say don't. And if you're a patient, I would say encourage your caregivers to still get some time on their own and get a break.
Can I just say how excited I am that the word caregiver has come up so much, that it used to be at things like this that we didn't talk about caregivers. So I'm so excited this is happening. I think that one piece is for the patient to thank and acknowledge, you know, and see that the caregiver is part of the story. And then to acknowledge that their experience might be really different. So I was talking to a survivor the other day and said, my wife, he was the patient, his wife gets the scanxiety. I'm sure you know the word, or feel the word scanxiety, right? The anxiety you feel coming up with scans. And he said, how can I help her? And I said, well, just listen. Listen to her fears. Don't bright side her. Don't downplay what she is feeling. Because he's like, I feel like everything's fine. And so, when I said that, he said, oops, I think that's what I've been doing to her. And so realize that you might be feeling like everything's fine and they aren't, that you're both going through this thing together and that the experiences you're having are different and the reactions you're having to it are different. And so to make space for that and to let them say, like, I might not be worried about this scan, but you might be. Like, how's that feel? And to thank them and acknowledge them and give space for their experience and feelings as well.
Can I say one more thing? I forgot this. This is kind of important for us because we're in our 60s, you know, we're the cool kids. And so it got to the point where one day he looked at me, he said, can I just hold you and you not say anything? And I'm like, well, you know, I'm a very opinionated person. and you know, he said, can I just hold you and don't say anything? So he put on his favorite jazz music, and for an hour, he just held me, and I couldn't say anything. And I was just like, so after it was over, I said, what was that for? He said, I just wanted to love you in my way.
Got one in the back.
Oh, that's a good point.
I'm going to try and recap that one. It's a really good point, so I might not do it justice. But the person in the back said that she's both a caregiver and a patient, and there's a lot of challenges that come with that. And sometimes there has to be an agreement to, agree to disagree, and that you're not always going to be able to come to a kind of agreement of how things should be. And she and her partner have sort of come up with a sort of safe term of helicoptering, and that sometimes they have to say, do I need to park my helicopter? And that's sort of their way of understanding that they might need to kind of back off from either of their roles. Do any of you have any sort of similar sentiments?
I mean, I think that's very wise, yeah, to have that. And so instead of resentment just sort of quietly building, to say, hey, I notice that this is happening when that does. I get why you might be hovering. I love that you are worried about me. I love that you're caring for me. And when I see you hovering, that makes me feel X, Y, Z. So can we have a word that when we see that's happening, that we acknowledge that? I think that's brilliant.
For me, okay, so let me just tell you, I'm Hawaiian and Japanese. My mother is Hawaiian and Japanese. My father is Ojibwe, French, and African. So I got all these cultures. And, on the one hand, my mother taught me she was Hawaiian and Japanese, and she taught me to be very respectful. On my father's side, they're kind of on the loud side. On the Native American side, I just got all this stuff going on. So I had all these people trying to give me each one of my culture's healing powers and, their methods for my recovery. And it got to a point where I just said, y'all need to leave me alone. Let me have a minute to figure out where I'm at and what I'm going to do. And it didn't help that my daughter had I didn't even know I had died on the table until my daughter got married in 2009. She announced it during, her wedding ceremony. And all my friends knew because we were all sitting at the table. And I said, well, how come somebody didn't tell me? And they said, well, we didn't want you to give up. But it's like when you have all these people who love you and who care about you, but you got all these emotions and like, God, have I done what I'm supposed to do? Have I fulfilled what my divine purpose was? Is there something else I'm supposed to experience? Am I supposed to be saying some profound words to people? And then it just got to be like, I just said, I love you all. There was even a time when I got really weak and I didn't think I was going to make it, and I called all my kids in my bedroom. And I said, listen, don't make my mistakes. Love yourself. Remember what I've taught you. Respect people. Take care of your finances and love on each other. And if you don't take care of each other, I'm going to come back and haunt you. And my daughter just boo-hooed so hard. She lived downstairs on the third floor, and she lived on the first floor. I lived on the third floor. And I said, girl, look, you got to go because I can't hold me and you up at the same time. But I think if I had joined a support group earlier, then I would have had the ability to know that I was going to have all these emotions because somebody could have told me. Somebody could have walked me through it. And now I think that's one of the most important things I want to tell people is share your story. Don't take it all in and suffer. You don't have to. There's too many people out here who have had the experience and are willing to share and willing to love and empower you and tell you it's okay to say, I had enough today. And that's all I got to say about that.
I'm just going to say, I think your divine words are
Bless your heart. Thank you. I received that.
So I've got another question. You know, a few of you have kind of touched on the anxiety around cancer and either lack of or heightened anxiety around having a diagnosis of cancer. And I think after finishing therapy, there can be a tremendous amount of anxiety. And how have you managed that, or has it not been a problem for you or for your families?
Yeah, it's been a long journey for me. This is my 17th year. And when I was diagnosed, I was given 9 to 12 months. And my colon cancer had metastasized into all 5 lobes of my lungs. And, the way I got through that first couple of years, I ended up going through 72 weeks of chemo, which if you're doing the math right is a solid year and a half, 26 weeks, 3 different times. 40 radiation treatments, double ostomy surgery, and so once I got through maybe, the first couple of years, then I had a lung relapse, had to have another lobectomy. So there was, in the first 3, 4, 5 years, there was enormous anxiety between surgeries and constant chemo and radiation. And when people in here, and we've talked about in the panel, and, the scans, and I bet, to help kind of some of that anxiety and the things you're saying, you cope with it. I've probably worked with 150 to 200 people, not in a medical sense, but in a support sense over the last 17 years. Ostomy patients, cancer patients. I tell them, right, you try and take it one day at a time. The best advice I can give to anybody out here who's been on on the beginning of it or has a family, one of the things I wanted to share today that I always share with a lot of the people I work with, even when you get better, right, it's linear. You for the most part, hopefully you get better and you're a survivor. But on that linear incline, there is a ton of peaks and valleys, And I tell people, and it's something I ask you to try to remember if you're going through it. When you get a really good scan or good blood test or something, it's great. You should take some, small victory in that. But I always try and tell people, don't really go home and spike the football. Because, we go in every 12 weeks, right? 10, 12 weeks. And I can't tell you how many times I went in. They said, we see something on this scan. We're not sure what it is. But you try not to get too despondent either, right? Because you go back in 10 or 12 weeks and they say, I don't know what it was, but it's gone now. It was bacteria or something, or infection in your lungs or something. So, the way I deal with it and did during that is what I'm trying to tell you is never try and get too high and never get too low. Because it is a long journey and there is a lot of, ups and downs in it. So the more you can try to stay in a range, right, instead of either crazy high and crazy low, if you can try and work in a range, I think that's the best advice I can give people.
Oh, she has a question.
So to that point, how do you deal with people who mean well, but don't let you acknowledge the reality of your situation? So you can't ever say, does that work? No. You can. So sometimes if you're not having a great day, or you're cautious about looking forward, and people say, oh no, you got to stay positive, right? But you can't. That's fake. Right? So how do you deal with people who mean so well and that you love, but won't let you acknowledge the reality of your situation?
I'll talk first and pass on. I think early on, and I don't know how this happened. Maybe it was just the way I was wired. I always managed an incredibly large group of hundreds of employees. So you get a whole different perspective of people. And early on in my diagnosis, there were people who said things that were really uncomfortable and maybe a little hurtful, but I kind of let them go. I think people around you sometimes are incredibly uncomfortable and awkward. They say some things, they might mean well, but it doesn't come out that way, or vice versa. So I just kind of let a lot of those comments go, and I always couched them in the idea, they mean well, they're afraid, they don't really know what to say, maybe they don't, up here they say it one way, but when it comes out it's a different way. So I would just ask people, you know, when people say things to you sometimes, you know, understand where they're coming from. They're not in your shoes, they're scared, maybe they don't know what to say. I had friends when I got diagnosed, and like I said, mine was pretty grim. I had friends who really distanced themselves. They were afraid. And I had what I'll call acquaintances who really came into my inner circle. So you're going to get people who are going to kind of run the gamut of what they say and do. And like I said, some are afraid and kind of distance themselves. Other people, I was shocked in how close they came for whatever reason.
Okay, first I'm going to talk about the anxiety, because since I've had cancer 3 times, it's like sometimes it's a dark cloud that's just hovering. And I decided that I was going to look at it like this, because I have lots of pain from the surgeries and from the scar tissue. And sometimes when I bend over, it feels like I'm having a heart attack, but it's just the scar tissue pulling. And so when I'm in pain, or the fear of it coming back comes in, and I know this might sound crazy, but I'm just like, I'm mahalo. I'm going to live this moment. And this might be 10 minutes of pain, but I got the rest of the 23 hours and 50 minutes to enjoy life. And I'm going to choose. And if I feel like crying, I'm going to cry. If I feel like having a pity party, if you don't want to be around, little violin, go somewhere else. You know, I'm just going to experience life and try and enjoy it and love on my kids and my grandkids and my son's dog, since I can't have one in my apartment. But, you know, it's like, so far as the people who mean well, everybody in my family and all my friends know, talk to the hand. That's what I do, seriously. If you're trying to be telling me, I had this one friend who would say, you don't have a positive attitude. And I told her, honey, if I show you my attitude right now, I'm gonna pick that shoe up and it's gonna come across this room. So you need to just let me go through my feelings, let me trust my God, let me experience life on my terms, and when I tell you talk to the hand, it's gonna be open like this for so long, and then I'm pushing you out the door. Because I don't have time for that. When you face death, your time becomes very precious to you. And you don't need, I said this when I did the fireside chat, Debbie Downers are not allowed. And Debbie Downers can be people who think they're telling you positive things. But if you want to love me where I'm at, and I'll love you back.
Yeah, yeah. Back to the anxiety one, I want to acknowledge that I think that, and especially I was thinking that a lot today with this in the survivorship space, is that we don't talk enough about what happens after the anxiety or after the treatments. And so often when we're going through it, when we're waiting for the scan, where we're going through the treatment, we're just like holding on. And that it's afterwards, after you get the results, whether they're good or bad. Actually, if they're bad, then typically you just keep going on, right? But when they're good, I often call that like hangover day or hangover days afterwards. Because like last week, my husband had 9 biopsies. So we were watching that my chart for all the results, right? And even though it was good news, there was a result, right? So there people are like, oh, great news, and then they move on. But we then have to live with and process the emotion of that waiting. And I think that happens in the survivorship stage as well, is that people say, you rang the bell, or you whatever, great, you're done. But often I think we don't process our emotions when we're going through it. And then it's afterwards that suddenly, for patients and caregivers, that it just all comes out. And I think that too often the people in our lives say, well, great. You're fixed, you're cured, move on. And it's like, oh, no, it's not always that easy.
I wanted to say that this is how I look at it. I'm healing every moment. And my healing process encompasses my mind, my body, and my soul, and my very being and spirit. And if you want to love me, ask me how I feel, and ask me if I want to talk about cancer, or ask me if I want to talk about something else. Just be kind, that's all.
I have a seat right up here.
From the caregiver perspective, in relationship with some of these emotional things. I saw my husband through 30 years of heart failure almost, and then the last was combined with cancer for another 15 years. And my mother through 93 with heart issues. And then my granddaughter got lymphoma, and at 13, it's a long time. She's 30 now, so I mean, she's still dealing with that. And I find right now I've got my adult daughter who's 57 living with me because she's sarcoma, and there's no surgery available for that. And I find that all of these things are so different depending on the generation of who's caring for who's the person, who's the caregiver, and it all intertwines and causes a lot of stress because of the relationship levels, not so much what you're caring for as far as how to care for them. That's some of it, because some has been more nursing type, others just more being there. But I find that the mother-daughter thing, the granddaughter-grandmother thing, you know, and now my other daughter is cancer survivor now too. So all my husband and I, both of my children, have cancer, and the relationship has been so different. And the fact about you living because you may only have this much to live. You know, I'm going to be 81, and
She looks good.
when I'm really tired from caring for a lot of physical needs for my daughter, and I don't resent doing that, but my body can only do so much. And then the plea of, I need to live because I'm dying from my cancer. It's really hard to not think I'm dying every day because I'm going to be 81 years old, and I don't have that future ahead of me. So it's a really hard balance. I'd like to just mention that for the people that might be in that intergenerational situation.
Yeah, I can't summarize that in a short way, but I think it's a really great sentiment of being a caregiver and the different dynamics of when you're caregiving for, you know, a parent or a spouse or a child or a grandchild, and all of the different dynamics of caregiving that can bring, and then the different stresses that can add to your own kind of well-being over time, and as you're aging as a caregiver, how that can also change things. But perhaps some of you can speak to how you've managed some of these dynamics of different levels of caregivers and where they're at.
Sure. I mean, my primary example is with my husband, and we're also very fortunate to have a really positive, loving relationship. But I know that that's often not always the case, right? And so sometimes, even if you're in a partnership, or if there's cognitive changes, like that can be really challenging as well. But I have been a remote caregiver for my mother-in-law who was in a different state and passed away from cancer. I have an 81-year-old aunt who lives here, and right, so every one of these is different. But I think that we're all going to be a caregiver at some point, and most of us are going to be a caregiver in multiple roles in different ways. And so I just think about what you said about, like, you're tired, right? 81 or not, and we both agree you look really good, by the way. But regardless of your age, you know, it takes a toll on your physical and mental and emotional, like every part of you. And so the statistics about caregiver health are pretty grim. And so sometimes they call caregivers the next patient because of the impact it has on us. And so I think it is important to think about how it can show up in different ways. And also, I'm glad you brought up the physical toll it can take.
I think the first time I had cancer, because I had like a village, I was very self-centered, and I only thought about me. The second time, though, I think that's when I started to see that he needed breaks and he needed to let somebody else pitch hit for him, and I'd be okay. But when I went back to my house, because, you know, he lives there, I live here, it works out better that way. All of a sudden, I noticed this really happened to me 3 times. I was sleeping, and the police came to my door to do a wellness check because my kids were outside and they were ringing the buzzer, and I didn't hear it the first time. The second time, my daughter called. She was at work, and I didn't answer the phone. So I hear this bang, 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 and I'm like, hello? And I'm in my robe and stuff, and they're like, are you okay? I'm like, yeah, I'm just sleeping. It's fine. The third time it happened, we had to have a family meeting. Because I'm like, you know, the apartment complex still counts this as a police visit. So I have to show them that I am a recovering cancer patient and I'm okay. But I think that, you know, when I listen to you speak, you're 81 years old, and I pray that we would all take a more active role in being caregivers or enlisting our family members to become involved. Because I think it's too much of a burden for one person to have to do that, because you need to live life too. You need to have some fun. Go to Hawaii, sit on the beach. I'll tell you my cousin's address. You can go. You know, but I just think that self-care is so important. And like I say, the first time I was totally selfish, and I must say I enjoyed all the attention. I enjoyed being pampered and people coming to give me pedicures and do my nails and do my hair and rub my back, and I never had to cook. Well, I couldn't really eat that much anyway, but still, I just enjoyed and embellished having people surround me with that kind of love. But this time, I have to admit, I'm trying to be more receptive, and I have become a caregiver. What I've actually become is I'm the person people call when they're getting ready to go to hospice, and I will sit with you until you transition. I try and provide comfort and care for everybody in the whole family. We've had pizza parties where we make pizzas. We've had cake parties where somebody tries to make a cake from scratch, and not saying I ate it all the time. But you know, you just have to start being creative and enlisting people to help the people that are helping people.
Just one quick comment on that, you know, to piggyback off Lee, you know, my original diagnosis and treatment, I probably was on the selfish side. Like you said, it's a lot about me, and, you know, you have fear and anxiety and your mortality. With my relapse and the second go-around, I think I was a little more appreciative and understanding of, you know, the caregiver and my wife, because, you know, it's not easy being a patient, and there's a lot of patients out here today. And whether you're going through chemo, radiation, surgery, you know, things like that, there's a lot of pain you deal with. But as I thought about it the second time, you know, I was in control of my pain. You know, I could decide, right, how I wanted to deal with it. But, you know, as a caregiver, you're not really in control. You know, you just have to sit and kind of watch. You try and do the right things. But I think it's a tougher job than people understand. It's not easy being a patient. But I can't imagine if I would have had to sit and watch my kids or my wife, and you're kind of helpless. In some regards, like I said, it was easier being the patient.
Oh, I wanted to say this too now. This might be something you want to enlist or share with your friends, but my grandson, when I had cancer the first time, he made these faces. There was a happy face, a sad face, and a mad face. And he would post them on my door with a piece of tape and warn people, don't go in there because this is how she is today. You know, but this little boy was only 10 years old, and he would rush home off the bus and lay next to me. He would sleep next to me on the floor. If I got up to go to the bathroom, he was there, because when I went to the bathroom, it felt like I had razor blades twisting and turning, and I had to have people read the Bible to me so I could get through it. But he would sit out there and do that. So his idea to save his mother and his uncles and my friends was to post that, and it worked out quite well.
I feel horrible having to wrap this up. This was so amazing. I feel like we could listen to this panel for another hour and not get all of their wisdom and knowledge, and just from everyone out in our audience today as well. Wonderful questions and insights. However, we do have to move on. I thank you all so much for your time, your openness, your just emotional, beautiful stories. It was truly touching and amazing. Let's give them a round of applause.
You have a good